long summer days and warm summer nights means you're spending a lot more time outside. That results in more stings, scratches, bruises, and rashes for you and your family. But what's normal and what's not? So I want to show you the summertime symptoms you should never ignore. I'm calling on my friend, allergist Clifford Bassett. He says summer pests will be out sooner and stronger like never before. So why should we be so concerned this year?
It's about the weather. Warm winters, wet springs, that's a perfect combination for misery. What we're talking about is mosquitoes. They're on the rise, they're coming earlier, there's more of them. And not just mosquitoes, poison ivy, our researchers tell us, are on the rise, and people need to have a game plan in place. Be prepared this summer.
All right, so there's one area that we should never ignore. It's ticks. They're on the rise as well. Come on back and we talk about Lyme disease, which many of you know of. And Sharona's joining us. How are you?
Good. How are
So do you have
you?
concerns about ticks in particular?
Yes, and I'm very concerned because I live on 1 acre of land surrounded by animals and woods, and I'm afraid that any one of us could bring them into the house.
So a lot of folks think that anytime you get bitten by a tick, you can get Lyme disease. That's true, you could get it, but of course, most of the time, you don't. What's the difference between a normal tick bite, Dr. Bassett, and one that might lead to Lyme disease?
Here's what you need to know. A normal tick bite might be painless. It might go undetected. It's so small, it's the size of a dot in a sentence. So really, what you want to know is about the Lyme disease rash. We call that the bullseye or the target rash.
Here's a picture of it, by the way. We can put these up. There's a normal tick bite on the left, and that right, see that? Looks like a bullseye, a target. That's a classic Lyme rash.
85% of people who get Lyme disease have this rash. That's 3 out of 4. However, you can still get Lyme disease and not have the rash. So you need to really be aware of this.
So if you find a tick, this is a big mistake a lot of us make. We don't know how to get it off our bodies the right way. Dr. Bassett, if you have a tick on your body and it's bitten you, what's the best way to extract it?
Here's what we need to know. The longer the tick is on your body, the more likely it is you're going to get Lyme disease. Burning it, people think that's a great idea. It's not a great idea. It will cause the oil to go into your body, the bacteria to cause more infection or Lyme disease. You don't want to do that. Also, petroleum jelly. It sounds good, it works, but it takes too long. You really want to get it done with a tweezer that's tried and true, and you want to have a steady hand like a heart surgeon.
Get that?
Yeah.
That's my cue. So I brought a tweezer. So I want you to show. Yes. Yeah, get your eyebrows.
Thank you.
So I want you to show me, how would you take that tick off the skin? That's the skin there. Go ahead.
All right. I think it's by the head, right?
That's very good. If you grab back here, just 1 second before you do that. If you think about it, if you grab the tick back here, what's going to happen? You're going to squeeze the blood from the tick into your body to get all the virus that's in there. So you're right. You grab, let's do it together. Grab the head. Now, this is important. You don't want to be a jerk. So don't jerk on the head or else you won't get it out of the body. You want to gently, without twisting, you want to get the whole head intact, lift it up carefully like that. See that coming out slowly? And there it goes. And once it comes out, you pull the whole body out. Once the tick is off the body, get rid of the tick. And then you need to clean the area. You have soap, rubbing alcohol. Make sure you don't get an infection on top of an already existing bite.
Okay, thank you.
You can keep that if you want. All right. What do you do with the tick after you find it? These are bad babies. What do you do with them?
People make a big mistake. They get rid of the tick. Keep the tick in an envelope or a little bottle. You want to bring it to your local health department or a lab. They can analyze it and make sure if it has Lyme disease bacteria. You need to know that. It's very important.
Good luck with that.
Thank you.
The next summertime symptom you should never ignore is the mosquito bite, because it can lead to a more serious condition. So most people think the mosquito bites is pretty standard, but actually they're not. There are many times you have to pay careful attention to it. So walk us through the different kinds of problems you can run into.
Here's what we're seeing now. I'm seeing patients that not only have a lot of mosquito bites, but the mosquito bites are big, red, and angry. They look like a skin infection. They wind up in the emergency room. It's a big problem. They may have a mosquito allergy. It's a reaction with the mosquito salivary protein, and it may cause Skeeter syndrome. Skeeter syndrome is on the rise, and it's a very big problem because people wind up in the emergency room, they're scratching it, it may get infected.
So let me show you a picture of what we're talking about. This is what Skeeter syndrome can look like. So the normal you see on the left there, you see Skeeter syndrome in the middle, and look at the severe version of Skeeter syndrome. You get blistering. I mean, it's pretty ugly. So what do you tell your patients whether or not they have Skeeter syndrome and how they should manage the mosquito bite?
Well, it's very important. As you can see, it goes from mild to moderate to severe. Mosquito bites are very important. You want to use the right first aid, and I call that pest first aid. And that's what we have here to go through to help people get through that. And if they get a bite, they can feel more comfortable and prevent complications.